Welcome to Beyond Words by Pop Family. I'm Heidi, mum and speech pathologist, and today we're tackling one of the most frequently mentioned topics in our inbox, tongue ties. What's a tongue tie, what it really means to have a tongue tie, and what the journey can actually look like. Hint, hint, it's different for everybody. Joining me is Lyndal, Pop's head of speech pathology and our clinical lead for orofacial myology. Now, that's everything to do with your mouth, face, muscles and structure. We'll get into that. Lyndal completed her Bachelor of Speech Pathology at Newcastle Uni and has spent years working in rural and remote Australia. So she really gets what it's like not having immediate access to the health services that families need. Lyndal is one of our many go-to speech pathologists at POP that we turn to for clear, evidence-based answers on tongue ties, feeding, chewing, swallowing, breathing, and overall facial development and growth. Having gone through her own tongue tie journey, this is the real life and no-nonsense tongue tie conversation that you've been waiting for. Welcome to Beyond Words, Lyndal.
Thank you for having me. It's so exciting to be here.
Oh, it's so exciting to have you on and to talk about your personal journey today. We're not talking about work, which is something different for us.
Yeah, it's actually funny. I was thinking this morning, this is such a full circle moment because I used to literally be a Pop podcast fangirl. That's one of the reasons as to why I applied to work here. And now I'm a guest.
Hooray. And now you're a star.
I love that.
A guest. Well, thank you for coming and being vulnerable to share your story. I really want to know and jump into it. I want to know how you learned that you had a tongue tie.
Yeah, it's quite a funny story. Way back when in uni, when we were first learning to do like traditional oromotor assessments, we were in the lecture theatre and I was with my best friend and we were looking in each other's mouths and I looked at hers and I was like, oh my God, why does it look so weird? Like, why does it look so different to mine? And it was at that moment that I'd realised that majority of my life had been a lie. And I, in fact, had a very restricted tongue and yeah, they didn't really, it was really surface level information at that point in time, though. It was like, oh, I've got a tongue tie. Cool. What does that actually mean? And it wasn't until I started working at POP and started my own learning journey as a clinician that I realised that it was having a much greater impact on my overall function and quality of life than what I had ever really realised. So, yeah, quite a profound journey and moment of realising those things.
Yeah, totally. I actually remember the moment when I learned about tongue ties too, and it's because a girl at university turned around and said, look, I've got one, I'll show you. And hers was actually connected right to the tip. And I remember thinking, and she explained about like the history and why her mum chose not to treat it and how, treating it and not treating it has gone in and out of vogue per se with doctors. And you just took me back there. And I remember thinking, but you have so much trouble with your speech sounds. Right? This particular girl in my class. Yeah. And I remember thinking, this is having an impact on you. Unbeknownst to me, I also had one. I did not realise. So mine wasn't having a functional impact on my speech, or that had a functional impact on a lot of other things. But at that time, I was looking at her going, oh, but this is quite severe for you. But I had one, and they just don't look the same. So you can look in 50 mouths and you'll see 50 different things. There are the same sort of things that we look for, of course, but it really is quite specific, isn't it? So
yeah, and I think it's ultimately not what it looks like, right? It's in relation to mobility and those restrictive tissues at sort of that myofunctional layer underneath the tongue, and really looking at then how that impacts on your speech and your eating and drinking and your airways and your overall facial development as well.
So the girl at uni who I could visibly see hers, that's what everyone pictures when they picture a tongue tie, like this tongue that won't move because it's restricted right to the tip. And obviously yours didn't look like that, but yours looked very different to your friends. And that's why you thought your mouth was normal and your friend's mouth looked really obscure. So I love that. That's a really good example too for parents and health professionals who are listening who are not trained in assessing tongue ties, because the number one red flag when a health professional says to me, oh, I've had a look and it's not there. And I'm like, well, you've just alerted me to the fact that you're probably not trained to assess it.
Yeah. And it's
because having a look is not enough.
Yeah, it's the age-old story too that you hear from parents, when we're in the initial consultation or early in the journey, that they've seen several health professionals or they've been dismissed by a lactation consultant or a pediatrician earlier on, or their GP or child health nurse, whoever it might have been. And so we're getting to the point of seeing children at year 5, 6, 7 plus, and the family's going, oh, well, no, we've had that checked out, and really having to educate and empower them to come on this journey and sort of look a little bit deeper into the root cause of those problems.
Oh, what a fun tangent. Okay, so back to you. On reflection, what were your symptoms as a child?
Well, my mum would probably attest to some of this because we've been on quite the journey talking about this together as well. But I was quite a sick child. I had really recurrent ear infections, tonsillitis, croup, you name it. I always had every upper airway infection possible. And so that has led into my adult life, and that's probably the next stage of my journey that we'll talk about in a little bit. But yeah, really sick child was one of them. I didn't have any speech sound difficulties, but one of the key things that I couldn't nail down until I had learnt about this was why I always avoided eating steak and why it would take me up to 45 minutes to finish a piece of steak at the dinner table, and why I just simply hated roast meat or hated any chewy meats. Like, I just couldn't figure it out. And it wasn't that I didn't like the taste. And it turns out that it was just hard work. And I was spending so long trying to break this food down and move it around in my mouth. And yeah, that was not traumatic, but I think back to it and just think, gosh, like that was just, I remember so many meal times where I was struggling so much and could never figure out why. So as a child, they're sort of the key things that stick out to me. But it wasn't really until I started learning more about my symptoms as an adult that I realized that there had been sort of lifelong symptoms. So things like chronic headaches and migraines, full body postural differences. So I've got some leg length discrepancies and scoliosis in my back, which we can talk a little bit about in a second. Or you've got a question about it? I just don't want to cut in. I need to decipher that for everyone else. What's a leg length discrepancy mean? Like a difference in my leg length. Like one is shorter than the other, which is really interesting.
Yeah, wow.
And so in relation to how that fits in with scoliosis and how on earth this relates to tongue ties, basically your tongue, the base of your tongue is connected to your deep line fascia. So your deep line fascia runs all the way through down to your toes, basically. It runs all the way through your body. And you've got fascia all over your muscles and all through your body. But that deep line fascia, if you've got a restriction in the mobility of your tongue and where that's connected, then that's going to have impacts on your hips and your knees and your back. And so what happened with me is that I had a really significant jaw shift. So my jaw was shifting to the left-hand side when I was making certain sounds. And it's not perfect now, but it's definitely significantly improved. I can actually watch videos back of myself on Zoom now, so that's good. But it was shifting really consistently every time I made that sound and got worse over time as I got tired. And the movement of your jaw to that side then brings everything out of whack. So it's brought my head posture forward. It's brought all of my right side up, kind of like this. And so that's where my scoliosis is. So that was a really interesting one to learn about. Subsequently, I've also had a lot of issues with hip pain and back pain. So as a teenager, in particular into my early adulthood, I really struggled with hip pain and I couldn't run. I couldn't run more than 200 meters at a time without significant pain. And I remember just breaking down as like an 18-year-old going like, why can I not do, these everyday things that all of my friends can do, and they can go and play sport and they're pain-free, and like I'm young and healthy and I should be able to do these things. And so, yeah, it's been really interesting learning about that component of my body and how it actually has all linked into the root cause of the problem, which was my tongue.
Which is incredible. And who are the health professionals that helped you learn? Because we're speech pathologists and we're both orofacial and myofunctional therapists as well. So we have additional training on top of our speech therapy degree in the area of, I'll call it OM now, orofacial myofunctional disorders, which is all of this stuff. But we don't necessarily know, for example, we can see and we can sort of assess the whole body. We look at posture and that sort of thing, but then we refer on to get those answers. Who helped you work out that your scoliosis and your, I have a very similar story. We need to then tell mine because my hips are always out. And then I'm always sitting funny on my chair, and I always need my legs up, and I always need additional support, and I don't use my core properly, and I'm hypermobile. So it's a similar case for a lot of people who have a tongue tie. And it affects across the spectrum. Like maybe you've just got really mild functional impairment, or like it's probably really livable and fine and you don't have any pain, right up to you can have really severe hip pain or jaw pain or some of the things that you've experienced. Who are the health professionals, or I'm assuming body workers, who helped you put all these pieces together?
Yeah, so I went and saw a chiropractor, and her name is Dr. Tanya Gee. She's based in Brisbane, and she was absolutely incredible, very holistic, uses a lot of principles from osteopathy as well as chiropractic. And basically when I saw her, I just remember my initial consultation with her. It was the most incredible appointment I think I've ever been to. And I don't know if it was also because I was a health professional with this background, and so she gave me like, a few extra tidbits and the gold standard, but it was incredible. And she, did all of her assessment, but then also sent me for a full body x-ray, which is actually how I learnt about my scoliosis, despite
So is that what, just an x-ray or an MRI or a CBTC or...
I actually don't know the correct terminology. That's really poor of me. But essentially you get into like this tube and you stand there and they do a full x-ray of your whole body. So that
like the one that dentists use maybe.
Yeah, except I think it just sort of extends the whole way down rather than just capturing sort of this part.
Because an x-ray captures like one image, If this is going around, I feel like it's capturing... it could have been a CBTC. We don't
Potentially, yeah. And so it was fascinating. And that's actually how I learnt about the scoliosis, which is interesting to me because I spent a significant amount of time, I reckon about 6 months when I was in grade 10 seeing a chiropractor because of all of my hip issues. So it's really interesting that was never picked up on or reported on, or if it just wasn't a super holistic approach.
Or it hadn't exacerbated enough, right?
Or,
we see these things, if someone goes, oh, well, like my child doesn't have jaw pain or whatever, we generally, with a tongue tie, right, we generally won't see jaw pain until adolescence or adulthood. Like it's got to be pretty severe for a little child to have jaw pain. And then sometimes they don't know how to explain it. I guess that's the other thing that we can say of why we might not see it very often is they might not be eating that steak because it hurts.
Yeah, well, and that's it. And it's interesting, I learnt recently this fun fact that for every inch that your head is forward, out of line of your sort of optimal posture, it adds 4.5 kilos of weight. 4.5 kilos. That's huge. And so looking at my posture as an adult when I got assessed and was looking at all of this, 2.5, 3 years ago, comparatively to when I was 15, that's sort of a great amount of time where that head posture was bringing more and more forward. I'm thinking about the movement of my jaw, like you would expect that it would exacerbate over time. That's my hypothesis anyway. So potentially that's a factor as to why it wasn't picked up on. But going back to Tanya, she was the one that helped me connect all of the dots and provided me with lots of education. And I went through with a surgical intervention for my tongue tie. So I went and had a frenectomy at Enhanced Dentistry in Brisbane with Dr. Martin Jones. And part of their protocol was that I had to have had a set amount of appointments done with Tanya, with the chiropractor, to look at that whole body tension and release and really look at how we could achieve optimal and maximal outcomes out of doing that release. So the surgery was as effective as possible. So they were the two primary people that really supported me with my journey.
I mean, that's why I've actually interviewed Dr. Martin Jones in 2 episodes about tongue ties many years ago, but they would still be pretty relevant. I should get her on again. So if anyone wants to hear from Dr. Martin Jones, they can go and listen to earlier Pop Family podcast or even Spot Family podcast episodes. It was a long time ago. And hear Dr. Jones talk about it. The reason why we love working with Dr. Jones at Pop is also because she's so holistic. She does have a lot of rules, like I won't operate unless there are body workers involved, and unless basically you're set up to have the best outcomes. She's not going to operate on you because the surgery may fail if the rest of the body is not in alignment and you're not able to do your follow-up exercises and those sorts of things, which I really respect, because a lot of health professionals would just operate and be like, okay, see ya.
Yeah. And I think also like having that really holistic team, if we think about the clients that we see coming through our door as well, sometimes the first person we do refer them out to is a body worker to see that if they do get that level of release, is that going to give us optimal function of the tongue? Like, are we not as restricted where we need to go down a surgical intervention pathway? So they're just such crucial people as part of that process to help that differential diagnosis and treatment plan.
I'm definitely going to have to get some body workers on the podcast. I mean, when I left university, it was, like chiropractors, witch doctors and, osteopaths, who are they? But I mean, I'm well over that now. I refer to them all the time. I think that they're a really integral part of the holistic team. I just use them in everyday life. I actually have a holistic physio that I go to, and I just am in awe of what they can teach us about our bodies and how it all works together. Because the one issue that I find with Western medicine is that we all know our part. Speech pathologists know from the head to the chest, and then the body stops there. Like what? What about the toes? Oh no, they don't exist. We don't know about them. We're not allowed to comment on them. It's not our zone. So we're allowed to comment on what's in our zone. But hello, your scoliosis is related to the issue with your tongue. And someone who's a body worker who works with the whole body, who sees the interconnectedness of all of the different systems and all of those different functions, is just such a valuable part of the health team and working those things out, especially when we as speech pathologists are like, well, we know what's going on here, but like, what about the rest of it?
Yeah. And it's also around like how we make informed decisions around treatment. I had a child the other day who had really restricted opening of her mouth and then really significant TMJ pain. And I thought, oh my gosh, I'm not doing anything until you've been cleared by a TMJ physio, because I don't want to exacerbate that and make it worse.
And I've just said that kids don't get pain.
Exceptional circumstance, very restricted.
Yeah. I once had a teenager in severe pain, TMJ pain, and we did almost nothing. Like, I was just trying to support her to eat without pain. We were like sucking food out of a straw. That's how severe it was. So, I was doing feeding therapy, but like skyrocketing, like trying to get her through to the public orthodontic sort of or surgical max fax type. Yeah. And when you're going public, it's really hard as well.
Yeah. And I did think that just goes to show, like, whilst you can have a tongue tie and have restrictions and things, it just has so many different outcomes for every person, or it can present in so many different ways in terms of your functional impacts or your symptoms that are on the surface.
Yeah. Okay. So I'm going to be the devil's advocate. I'm listening to this. I'm going, but you're just believing your own BS. Like, you both believe in this stuff, and like, why would your tongue tie cause all of these things? What would you say to someone, I guess, who thinks that, who thinks, nah, like that, how could you prove that, or how could they all be related to this one thing?
Yeah, I mean, it's funny because I feel like I've had this healthy debate with a lot of dentists and who, don't receive this additional training at university. And so I'm a firm believer in knowledge is power and advocating for my own experience to help inform and educate people. And I think that the biggest takeaway for me is that I have gone down this pathway. I've had this surgical intervention. I've done all of the right things in terms of prehab and rehab and doing orofacial myofunctional therapy. And my symptoms are gone. Like I've had a significant reduction in my headaches. I don't have hip pain anymore. I can run. I've retained my swallow. My jaw shift has significantly improved and my entire face shape has changed completely. And so I think I totally get where people are coming from and going like, well, is this something that's overdiagnosed or overtreated, or what tangent are you going on around this? But I think at the end of the day, it's really important that people have the knowledge and power to be able to identify what these symptoms could be and how they actually are having an impact on their lives. And, have they ever actually looked into it, or have they asked the questions, or who have they spoken to or done their research on it? Not everyone has to believe in it, but if it's people living their experience every single day, then I think that, they deserve to have access to that information.
Yeah, absolutely. And not just be sort of shut down because it's not necessarily what's taught at university right now.
Yeah, exactly. And I wasn't taught about it at university. As I said, we did that one oromotor assessment and it was referenced as this elusive creature that can exist in your body. But that was essentially it.
Yeah. I found that university told us, I vividly remember being told that oromotor exercises don't work. And then I went and did a placement at the Royal Women's Hospital in Brisbane, which is like an A++ hospital. They're like the smartest women in Australia in the speech pathology team in there. They are superstars. And all of them do oromotor exercises. We're there. And I was like watching them. They do OMAs, which is an oromotor assessment. And then they do, and then I was doing oromotor exercises with all these dysphagia, which is swallowing. If you have a swallowing disorder and you can't use your lips and tongue and you're going to choke on your food, it was my job as a student to do oromotor exercises. So exercises where you work the muscles of the lips, the tongue, the jaw, the swallowing system around the neck, I guess I'll say, for parents. And my patients got better. And now I was in rehab, so not everyone gets better. But it was working. And I was like, oh. And then I asked my supervisor, I was like, at uni, they told us that this doesn't work. Why are you doing it? And the answer was, because it works.
Well, and I think that that's the component of evidence-based practice, right? There's also practice-based evidence.
Mm-hmm.
And that's how we form our intervention plans and our management of clients and, well, in my instance, myself.
Yeah. Not everything has been studied yet. So science is a continuum. We love to, and I feel like some health professionals are too rigid in, and it's not actually evidence-based practice if you are too rigid only on referencing the research that has been done, because not everything has been researched yet. So if you're doing true evidence-based practice, you are taking the personal needs, desires, and values of the person that is in front of you, the patient, and you are putting what research is available for that and going, okay, we're looking at these two things together. And then you're looking at what is practically your experience in the field. Now, the more experience that you have, the more robust that evidence-based practice triangle is, and the more you can bring to the table for that patient. And that's what we're talking about. I mean, both you and I are passionate about this because we have lived experience we both have had orofacial myofunctional disorders that have impacted our lives. And that's why we're passionate about working with other people who have this. And so it's not necessarily something that you're taught about, but it's something that, we feel we feel is very real, and we get very good results working with people to make it better. So I'm got to go back to my questions. We've had such a good chat today, but I want to go back to the main symptom as an adult. Like, what was the worst thing or the tipping point that made you go, oh, because surgery is a big decision. What made you decide to have surgery?
Yeah, it was a huge decision for me. And I think that here I am saying knowledge is power, but I think almost like being a health professional and working in this space also made it a little bit terrifying, because I was like, I know every possible outcome here and I know so much about it now. But the real tipping point for me was the headaches. I had chronic headaches and migraines, and being a speech pathologist and seeing a full caseload of people every single day, we do a lot of talking, and I would get to the end of the day and it just felt like the base of my skull had been put into a vice and it was just being tightened, and it would just get worse and worse. And so it would start at the base of my head there and then sort of come into my jaw as well. And it honestly was just relentless. It just got worse over time, and I just thought, I just need to do something about this. Like, I can't get through a work week. And I knew at that point what the root cause of the problem was, so I was pushing through it, but I just thought, oh God, I need help. Like, I can't see longevity in doing this as a career long term if this is how I'm feeling after a day full of talking. So yeah, that was really my tipping point.
So then when you decided to do surgery, can you please explain, you didn't have like a typical tongue tie procedure, and I would sort of explain what you're talking about as like tension headaches, right? Like, so for a parent listening, you know, we've got skin. Our skin is an organ. It covers our whole body. The fascia is like a second skin underneath our skin, right? Mm-hmm. It's like these little interconnected, it's like a web.
Fibers.
Yeah, fibers. And if you eat meat, sorry if you don't, but if you eat meat or you've seen meat, it's where if you have fat on the meat and then the muscle and you break those two things apart, there's fibers in between. That's the fascial layer.
So that kind of like translucent layer that's a little bit elastic but still quite taut.
Yeah. So that gives an idea of what the fascia is, and that is underneath your skin over your entire body, and it's all interconnected. So when you decided to have that surgery, you went in for Dr. Jones at Enhance Dentistry in Milton, in Brisbane, and she told you what?
So she was very thorough in her assessment, and I had done my own assessment, had written my own referral, of course, and put myself through my own orofacial myofunctional therapy before I got there. But essentially, we sort of identified I had a tongue tie, buccal ties, so cheek ties, all four, so upper and lower. And
okay,
also,
so that means you had ties.
I mean, they're still there.
Here.
Yeah, we haven't released those because they weren't having a functional impact on me. Yeah, as an adult, I think when you're looking at children and infants, if it's having an impact on things like breastfeeding, absolutely, it's something
and
that they will
sometimes toothbrushing, because you can really hit those. For anyone watching, this is what a tie looks like, and you can have that coming down in between your teeth at the back of your cheek. And if your child is going, ow, when you're brushing their teeth, it's because you can literally be brushing that bit of fiber that's coming down, and it can really hurt, like if you run something along there. That's why a lot of people with lip ties actually, they get busted at some point because they're fragile.
Well, it's funny you say that. I actually did that to myself with my lip tie when I was brushing my teeth. And I have a photo of it, and it's ulcerated. It was horrific. So I was like, oh my gosh, I've given myself an at-home frenectomy. So yeah, I had an upper lip tie as well, but I wouldn't say that the lip tie was super restricted as such, but the intervention pathway that we went down, I did have the frenectomy of my tongue tie. So that was done with a water layers machine, which was really fascinating to go through that experience. And then I had what was called the stibuloplasty, I think is the correct terminology. And essentially it was, Heidi's showing you on the video if you're watching, but basically it was releasing sort of that upper section in between kind of, your gums and your lip. And the purpose of that was to support what was happening with the headaches. So one of the root causes of the problems with the headaches was that because of the tongue tie and because I was trying to get my tongue in optimal resting position and keep my mouth, which means like tongue up, your tongue tip up just behind your top teeth, and then you should have your tongue lightly suctioned to the roof of your mouth across the whole blade of your tongue. So sometimes people will say, my tongue does sit up there, and it does at the front end of their tongue, but then the back end is sort of pulled down if you've got what's called like a posterior or an embedded tongue tie. So you can't always see them, right?
Because I didn't do my rehab properly.
So yes, you've got to do your rehab. So basically because I was trying so hard to make that happen so that I could breathe through my nose and do all of the right things, so many muscles in my face were compensating all of the time. So, and engaged all of the time. So I was clenching my teeth and clenching my jaw. My cheeks were always on. And so hopefully we can provide some photos of this as well. I just had so much tension in my face all of the time. And I remember when I did some external training in orofacial myofunctional therapy, and we were learning about assessing just general resting facial posture, and how you sit at rest. And they outed me and they were like, that's not your resting posture. And I was like, no, it is. Like, it generally is. And they did this exercise where you had to tap on this little muscle here. It's called your mentalis. And they're like, just tap on it.
Muscle, if you're listening, it's your little chin.
And they got me just to tap on it, and they were just talking to me. I'm sitting there tapping. And all of a sudden, my face just dropped and it just completely relaxed. And my mouth opened and my tongue dropped, and they've gone, that's your resting posture. And so that was really fascinating to me because I was like, oh my gosh, I am engaging all of these muscles all of the time. So Dr. Jones effectively...
That feels very good.
Doesn't it? Because everything just like...
over here. Yeah.
Everything just relaxes, and you can just take a deep breath and you feel calm, and it regulates your nervous system. And so whilst Heidi's having her moment, I'll continue.
I'm just regulating.
And so, Dr. Jones did her own assessment, which I found really interesting too, because she effectively did that. She got me to put one hand on my knee and tap that, and she was talking to me and got me to do a whole bunch of other things. And what she was watching the whole time was what happened to those muscles when I did relax or when I wasn't focusing on actively engaging them, and they just stayed engaged, basically. So that was the decision to do that procedure. And part of that was that I actually experienced an increase in the length in my philtrum. So your philtrum is sort of this section between your nose and your lip. And that dropping down gave me just enough length. Like, I've gained 2 to 3 millimeters in length, which is pretty fascinating. And so that dropping down meant that lip closure was much easier for me. It was supporting me to turn all of those other muscles off, paired with the frenectomy of my tongue, so that tongue tie release, getting it into the right spot. And that sort of supported the outcomes that I've got now.
That's awesome.
It's so cool.
And so we're not talking a lot about orofacial myofunctional therapy today, because we're not allowed to give testimonials as speech therapists. So you're telling your own story, but you're also your own therapist. So if we were hypothetically talking about somebody else who's having because at POP we do pre and post frenectomy, which is the surgery that you had. We do pre and post frenectomy treatment. So if you're a parent listening, we basically are like the physio when you have a knee reconstruction. You just shouldn't have a knee reconstruction unless your knee is ready beforehand. You've got to have a certain amount of strength because you're going to have to retrain your, ligaments and all the soft bits around the knee, they've got to be ready. So if they're not ready before surgery, then it might not work as well. And then after the surgery, you need to learn how to use your new knee. So you need to train and do little exercises and build up all the little tendons and muscles and, stretch it out and strengthen it and all that sort of stuff. So that makes sense to everyone because everyone knows someone who's had a knee reconstruction. But it's not a tongue reconstruction, but
or a tongue kind of feels that way, to be fair.
It does. It's a facial reconstruction.
Yeah.
Oh, that's another added benefit. Your face will get a little bit more symmetrical when your muscles are more aligned. So, there's a beauty side effect. 10 years ago when I first studied orofacial myofunctional disorders, I was like, wow, there's an industry in this. Like, if I cared about beauty, I'd be in it because you could sell it as a beauty hack. Face gets more symmetrical. Your lips will generally get a little bit more plumper if you've got lip closure or any other lip issues. Sometimes your lips can be oversized but there are whole things to do with your facial appearance that are to do with how you use the muscles in your face. They're muscles. Like if I do this muscle's going to get bigger, right? So if you do certain things in your face will change shape. And if you have certain tension, you'll have more lines and you'll have more, I've got my lines and I know what they're from. I literally know where my little wrinkles are from, which is maybe knowing too much, but that's such an interesting thing as well.
And I used to think that, it was the truth, that my cheeks and like my buccal muscles, they were so bulky because they were so engaged all of the time. And so I've noticed a huge difference in that for me to physically touch them. Like they were rock solid. And they're not anymore, which is fascinating. Yeah. Like it's changed so much with actually having the right muscles doing the right jobs.
Yeah. And your muscles shouldn't be tense all the time. That's what we're saying. So when I look at someone with a certain facial appearance, especially when they've got this line here under their chin or they've got dimples, there's a
Speaking of.
I know, that cute little dimple. Under every dimple is a tie, which is fine. Like we've both got ties. And there can be some benefits of those things aesthetically, like a cute dimple. So yeah, all of that stuff's really interesting. In terms of the importance, went on a tangent, what is the importance of doing orofacial myofunctional therapy pre and post frenectomy?
Yeah, well, I think in terms of the pre side of things, basically what you want to do is set yourself up for success for after the surgery, similar to how you would with physiotherapy. And the way that I like to think about it and explain it to parents often is when you're starting off with a tongue tie, it's kind of like your mouth is a roadmap, right? And your tongue is the car, and it can only go to certain points on the roadmap when it's restricted. And so how that functionally looks is that when we are trying to swallow our food, or if we're trying to chew and transfer food to the other side, for example, like I used to be really terrible at lateralizing my tongue to the left side of my mouth. So I just chewed sweeping my tongue over to the left side. Lateralizing is a bit of, OM lingo, but I had a lot of trouble doing that. So I just ate everything on the right side of my mouth because it was easier.
Which also is going to make the right side of your face overdeveloped, which is going to give you asymmetry in your face. You're going to have a bigger, stronger right-sided muscle than your left side. So I'm trying to draw on everyone's, vanity here. But if you do see asymmetry in your face, it's probably because something as simple as you're just chewing on one side the whole time. That could be it.
Yeah. Definitely. And so when you can only go to certain points on the roadmap, you can see those difficulties functionally with eating and drinking and speech sounds at times. And so when you do the release, all of a sudden you can go to all of these other places on the map that you've never been to. It's like going on a fun holiday. So you have to teach your tongue how to get there. And I think that it was really interesting. I remember in the first week after the release, I bit my tongue so many times. just like during conversational speech, during eating, and to the point where it was almost frustrating me, but I was like, no, it's okay. My brain's just trying to figure out where it needs to go. And so with the pre-frenectomy exercises that we do, it's about teaching the brain all of the different types of cues and essentially pre-programming what those motor patterns are going to be, so that then once you've got that extra mobility and you can go to those extra places on the map, your brain already knows what to do. You're just then instructing it to go there. So you're going to have much better outcomes if you've done that work prior. And there's also part of making sure that when you've come out of that surgery, you're not feeling your best self. And so you want to be able to have some of that foundation and backing to know just what you need to get in and do those stretches and get it done, because it isn't the most comfortable thing in the world. So I think that it's ultimately about setting it up for success long term, and then retraining things like you swallow and how to integrate that with eating and drinking, and how to move food to the left side of your mouth if you've never chewed on that side before consistently. So it's retraining all of those functional things that we do in our everyday life.
Who can do orofacial myofunctional therapy?
Speech pathologists who are trained in it. Basically, orofacial myofunctional therapy isn't regulated as such. No one necessarily owns it. So we see dentists who are trained in it, oral health therapists who are trained in it, speech pathologists, IBCLCs, so International Lactation Board of Consultants. Did I get that right?
International Board Certified Lactation Consultant.
There we go.
You don't want to be seeing any other lactation consultant. If they don't have the IBCLC, don't see them. Make sure they have the IBCLC.
Yes. So, really, generally speaking, anyone who is working inside the mouth can be trained to provide OMT.
And my argument is, so I've had IBCLCs as a part of my breastfeeding journey for both times, and they are, especially OM trained IBCLCs, are just incredible. Dentists, we work closely with dentists who are trained myofunctional therapists, and physios as well for TMJ pain. So we all accredit the information to then we pull it across to our field. The reason why I think that speech pathologists are the best pre and post frenectomy therapists is because we are the only ones who also do eating, drinking, swallowing, chewing. That is actually ours. We own that. We're the only ones trained to do that. A dentist is not best placed to teach you how to eat because that's not a part of their core training, just like we're not best trained to
tell them about their teeth.
Tell them about that things, or to work on TM or jaw pain. So we don't work with pain. That's a physio. So we tend to have a community of myofunctional therapists who are also health professionals that we refer to at POP, who we trust, who can do specific things depending on what you or your child is presenting with. Yeah. What's really important that we haven't covered today?
I guess one part of my journey that we really haven't gone into today is also the facial growth development side of things and my orthodontic journey. And it's something that I sort of forgot to reference earlier. I was the kid with 3 rows of teeth, quite literally. So going through that experience and looking at then how that flows on to adulthood and how, my facial growth is now set by the orthodontics that I had as a child or as a teenager. And could I have had further intervention? Yes, definitely. But I am at the stage now where, look, I'm not going to commit to go and get a palate expander at my age. I know that you've done it as an adult and I think that deterred me. So it's all about then sort of looking at that experience that I've already had and what my parents invested in and how I can actually achieve optimal function now. Like, it's not going to be perfect. And I think that that's really important to stress. With orofacial myofunctional therapy and supporting people through their journeys, it's not about perfection. It's about optimal function and holistic health and looking at improving their quality of life outcomes.
Yes.
And longevity.
Checklist. Can you speak clearly or can you speak confidently? I don't really care if you have my amazing, incredible, sexy husband has a lisp. I don't care. He doesn't care. So whatever. Can you speak confidently? Can you eat well?
Can you eat the foods that you want to be able to eat?
Can you eat
the
that steak now?
Yes, I can. And I love steak. And it's like so enjoyable for me to eat now, which is, I don't know, it's just one of those simple pleasures.
Yeah.
Right?
And can you breathe? Arguably that's the biggest one, because if you've got a tongue tie and you've got that low resting tongue, it's one of the reasons, but you don't always know, chicken or the egg type of thing, but it's one of those comorbidities that sometimes sits next to mouth breathing, and mouth breathing leads to that forward posture, which leads to all of those whole body issues.
Mm-hmm.
You know, I also know, like I've got a toddler who's night trained. Every time she has a blocked nose, she wets the bed. Every time.
That's interesting.
I love having children. They're the best case study ever. Every time. So she wets the bed, I know a cold's coming.
Wow.
Yeah. So she is mouth breathing. She wets the bed. She just doesn't your sympathetic system is not right. You're sleeping in fight or flight. And that's why we see in kids who have ties and mouth breathing issues and sleep disordered breathing, we see bedwetting quite a lot.
Yeah.
Into the older ages. So sleep's a big one. We can have whole podcasts on that. I've had a few podcast episodes on that as well, but body health, postural issues. So are you living without pain and without, a lot of people don't have access to spending a lot of money on body workers, especially if you're in remote Australia. There might not be a body worker within a 500-kilometre drive of you.
Yeah. And I mean, that was my experience at the time. I was living 6 hours west of Brisbane. So, I had to commit to spending a few weeks in Brisbane either side and doing the travel to Toowoomba consistently to be able to get that support. So, yeah, I think that's a big element of it is like, you're always going to have best case scenario of how we support people in their treatment plan, but then it's best case scenario in terms of what is actually achievable for them in their context.
What's achievable? What can you afford? What's going to be, you want the lowest hanging fruit first. Like you want to be, pain generally trumps everything. So if you're seeing us and you're in pain, then we're going to be trying to case manage you out of that pain because we don't deal with pain. So we're going to be trying to send you somewhere to help support that pain, even if it's short-term pain relief, which could be body work, whilst we move up to something else, or long-term pain relief could be orthodontic treatment, those sorts of things. But yeah, they're complex cases with so many different things. And the last one that you mentioned is that facial growth and oral health. Like if your face doesn't grow properly because you've got a tongue tie, then you can have teeth crowding, you can have, more fillings and rotten teeth. Like all of that stuff costs money. It's if you have gum disease, you're more likely to get dementia. Like it's longevity.
Yeah. And I mean, in my instance,
whole body health.
Like my reduced facial growth, especially in sort of that mid-face area, so sort of your upper jaw, I have the smallest eustachian tubes and ear canals and all of the things that you can ever imagine. And I've just come off the back of 5 weeks of vertigo from persistent ear infections as an adult. And I'm considering, like, do I have to go down the pathway of getting grommets as an adult? Like, is that not going to be needed potentially? So it's, looking at what is going to make the biggest difference for people at the time.
Yeah. And so if we can catch those kids early on, we can grow their faces out so their eustachian tubes aren't trapped inside small faces, essentially.
Mm-hmm.
We want to grow those faces big and wide as early as possible. And that's probably the best preventative approach to all of these issues.
Yeah, definitely.
And then you're not going to have any speech errors either because you've got plenty of space for your tongue to just like chill out in there and make all the sounds that it needs.
No placement errors.
Oh, yeah. No placement errors. We won't talk about the other errors. We'll just talk about like the lisps and the slushy ones,
Yeah.
Well, thank you, Lyndal. What a treat. I know that so many people are just going to really find value in hearing your story.
Pleasure. Thank you for having me.
I hope you enjoyed hearing about Lyndal's tongue tie experience. I'll be sharing loads more on this topic on our Facebook, Instagram and YouTube, so make sure you follow @BeyondWords by Pop Family. Head to the show notes to get our tongue tie downloadables snapshot, plus hit the follow button for even more episodes. Before we wrap up, I'd like to acknowledge the traditional custodians of lands, seas and waters throughout Australia and pay respect to elders past, present and future. Please also remember that this episode is not clinical advice. If you or your child are facing challenges in the areas that we discussed today, please seek an individualised speech pathology assessment or chat to your GP. Take care and we'll catch you in the next episode.